I'm Dr. Gwen, and my channel is all about creating content that empowers the neurodiverse and disabled community. Have you ever heard of auditory processing or are wondering what is it exactly? In today's episode, Dr. Bea Braun, who is an educational audiologist, comes on the show to help us understand the difference between hearing and auditory processing, the symptoms of auditory processing disorder, and the treatments she's found to be really helpful. Welcome to the show. I'm so excited to welcome Dr. Bea Braun, educational audiologist and owner of the Auditory Processing Diagnostic Center. Hi, Bea. How are you?
I am great, Gwen. How are you?
I'm great. Thank you so much for coming on to the show today. Actually, before we get started, if you could actually tell the audience a little bit about yourself, that would be great.
Oh, yeah, sure. So I am a doctor of audiology and also an educational audiologist. So I have been doing central auditory processing evaluations. Oh, gosh, I have to think of this for over 20 years. It's more than that, but at least over 25 years. Good Lord. Um, and I love it. It's my passion. It's what I do. And I think it really helps people, and I feel like it's making a difference in their lives, the ability to change the auditory pathways, which is so foundational for learning. And I'm also testing adults, so I test children and adults, and I love it.
That's so great. And I think it's just one of those senses that doesn't get a lot of credit per se in how complex it is. And I'm hoping that we can kind of dive down into that today. And so maybe what we can do is even just start there, Bea, where, is there a difference between like hearing and auditory processing? Or are those the same thing? Or, can you help us understand those?
Oh, for sure. And I think that's probably the biggest misconception, because when I'll talk to parents, even professionals, they'll say, oh, well, my hearing is fine, or her hearing is fine. This is 100% nothing to do with hearing. The physical mechanism of hearing is at the ear level, right? That's where sound comes in to get processed as sound. We hear soft sounds, we hear loud sounds. Every audiologist will do a hearing test, which is where you put the headphones on or you get little inserts in your ear, you hear the beeps, you push the button, that's going to check your hearing, which of course I do before the evaluation as well. So that's your physical hearing. But then what happens is that sound leaves the ears and then traverses up the auditory pathways in the brain to finally get processed as language. So we do not process sound in the ears. We hear the sound in the ears, but then the information leaves the ears and finally gets processed. But it doesn't just go straight shot over to the language side. It traverses lots and lots of different areas of the brain. And so my favorite quote is Dr. Jack Katz, who's kind of like the grandfather of auditory processing, and defined it as simply as what the brain does with what it hears. And so that's really what auditory processing is. And I'll also clarify, we have two terminologies: auditory processing, central auditory processing. Exactly the same thing. They're exactly the same. It's a bit of just a terminology issue in the field. And so what they've come up with is to put central in parentheses. So it kind of is the umbrella. But central auditory processing evaluation are disorder exactly the same. So then my testing is all about how do we figure out where in those pathways the weakness is happening, because you need to get targeted intervention. So important. And so that's where my testing really delves into where the issue is, and then how do we remediate. A lot of times what will happen is you'll go through a psychoeducational assessment, and the psychologist will give some tests, the TAPS now 4 is a pretty common one, or they give a couple of things from the Woodcock-Johnson, which are very limited in what they look at. And so then if there's a problem, they might say, oh yeah, there's an auditory processing disorder. But that tells you absolutely nothing. I mean, it literally tells you nothing. It's like saying you have a language disorder, but what does that mean? It could be lots of different things. So, or we'll have a speech language pathologist do some tests, which actually I think are very powerful because they're a little bit more targeted. And once again can say, yeah, there's an auditory processing disorder, but it doesn't help. So I love that they're now doing those tests, and they're now saying, oh, we have some auditory processing concerns, but really the next step then is to get that individual in for a full assessment so we can figure out exactly where the issue is, and then how do we remediate.
Yeah, absolutely. I mean, I think like the hearing system, we don't realize that it really is a brain thing. Like, instead of an ear thing, it's a brain thing, right? And
Yeah.
how does this really play a role in, again, not only language and what we understand, but it plays a role, I mean, inevitably, I think, in the social realms of interaction, right? Because of
Oh, for
conversation,
sure.
reading, listening to like different cues that sound can give us in regards to feelings and sarcasm and all of that good stuff, the prosody of language. And so this is just something, and as a psychologist, I was always really careful when I was doing psychoeds because I was like, I don't know the visual system well, and I don't know the auditory system well because those are their own areas of expertise. I can tell you that we probably need to look at those systems because there's some things happening here that are showing up in these places, and we got to get that more or further evaluated. And so I love that you're like, gosh, psychoeds sometimes, or psychoeducational evaluations and speech and language therapy kind of evaluations, that is fine from a surface or superficial standpoint maybe, but that to really get into what exactly is happening from a auditory processing standpoint, that really does take someone like you to really parse out so that the intervention is targeted and right.
For sure. And you're just talking about the prosodic aspect. So it's so interesting because
Uh-huh.
the left side of our brain is where we process sound and language. The right side of our brain is where we hear music and where we see pictures. So when an individual has difficulty with the left side of the brain, what we call auditory decoding, they may mishear sounds. So, boost versus boost, boots versus boost, desert versus dessert. I'm going to give an example because I think it's just typical. So I just was talking to a mom on Zoom the other day, and her daughter sleeps with little stuffies, and she calls them peeps. And so the mom walked in the room and said to her daughter, "Oh, your peeps are all over the floor." And she said, "Why is pizza on the floor?" So imagine that in a classroom where the kiddo literally just heard something that makes zero sense to them, and they're trying to figure it out. And now the teacher keeps going and they're still stuck
Mm.
on, why is there pizza on the floor?
Yeah.
So that's the left side of the brain. So that's the decoding, which we treat very differently than like maybe a prosodic interpretation difficulty. So right side of the brain is music. So if I say something sarcastic like, "Oh yeah, that looks great," my tone of voice is the only thing that implies sarcasm. Most individuals with auditory processing tend to have super strong right brain skills. It's actually their superpower, if you will. But they
Mm.
have to send it across this bridge, the corpus callosum, to interpret it as language. And oftentimes there's this weakness in the bridge. So what can happen is they can misinterpret tone of voice. They can misinterpret body language, facial expressions. They often feel like people are angry or upset with them when that's not the case at all, and they'll say, "Why are you yelling at me?" And the parent will be like, I'm not yelling at you at all. So it's this kind of misinterpreting that can happen. And so it can really, really impact those social situations, the pragmatics, friendships, and even relationships with parents, because it can be really challenging. And I always feel bad because as I do my Zoom call and go over everything with the parent, they just feel terrible, because like I've been like making it be his problem this whole time, like he's not paying attention or he's not listening, or he's too sensitive, those kinds of things, when in
Mm.
fact there's just this problem, underlying foundational auditory processing problem.
Yeah. You know what, B? I'm wondering if you could um, talk about, because we actually kind of covered some symptoms. If you've got any kind of auditory processing difficulties, what are some of maybe the other symptoms or some of the other things that you might see going on for someone?
Yeah, so it depends on the subtype area again, right? So we
Hmm.
have multiple subtypes. So oftentimes, though, kind of the, say, almost universal one is difficulty following multi-step directions. That tends to be a really big one. And that can be for problems on the left side of the brain, the right side, the bridge. So that could be a big issue. The other thing you'll often see is difficulty understanding background noise, mishearing things, even though hearing is completely normal. Academically, you'll see difficulties, and this is always interesting because a lot of even professionals are like, well, how would this impact reading? But it really dramatically does. So you can see difficulties with reading fluency if the issue is bridge related or left side related. So it's really about the sound, putting the right sound, auditory cortex, with the symbol on the page, or the ability to see the symbols right side and then send it over to put the right sound with the symbol that's on the page. So it can be multifaceted. Reading comprehension tends to be a challenge, and it's really kind of the bigger picture with reading comprehension, parts to whole. How do we get that big picture? So you'll see reading comprehension. Of course, listening comprehension in the classroom can be impacted. Math word problems. I know you'd think, why is that an auditory processing problem? But in fact, it really is, and I'll share why. So left side is language, right side is pictures. So if I say something simple to you, Gwen, like, oh, look at that purple butterfly with yellow spots, we process the language on the left, but then what happens is we send that information across this bridge, the corpus callosum, to get over to the right side, and we create a picture of that butterfly. So your butterfly looks different than my butterfly.
Mm-hmm.
So when we have a weakness in this bridge, I'm looking at the auditory piece of this multi-laned highway, if you will. There's visual tracking, there's sensory issues, there's motor pathways, lots of stuff happening on this corpus callosum. But I'm just looking at the auditory piece, but I pick up on the weakness on that bridge. So when you have a math word problem, you read it, you have to create a picture of it. You cannot do a math word problem unless you get the big picture of what it is that you're trying to do, and then you have to break it down. So very common to have math word problem difficulties if you have this bridge issue. You typically don't see it if you have the left hemisphere issue. You can also have some difficulties just with sound in general. So like localizing sound can be difficult. That tends to be more low brainstem. And then you can have difficulties, we've talked about that kind of pragmatic social stuff, do someone's feelings get hurt a little bit more than they should? Are they misinterpreting what's being said? Typical example is if I say, look out the window versus look out the window, totally different meaning, all brought on by emphasis on one word. But some kids don't get it. They don't, even adults, they don't get it. So that's, once again, as there's difficulty interpreting that tone of voice. So it can really impact communication in general. And I think lastly, the thing that I'll share is, and this tends to be a big one, is if I were to ask you to tell me about your last vacation, you get this movie playing in your head immediately, right? You see it. And then what happens is you stream it right across that bridge. You get to the language side, and now you're able to retell the whole thing. What can happen with people who have this bridge weakness is that they have the most intricate movie playing. I mean, they see every detail, right? From things that I wouldn't even notice because that's not how my brain works. But because the right side of the brain is so strong visually, they're just off the charts. But then when they have to share that information, if the bridge is weak, instead of it being like a stream, it's like a snippet and a snippet and a snippet. And so things just get all out of order. So you could see they forget pieces of the vacation story, but they don't realize they didn't share it because the movie's so strong, but it leaves the listener very confused. Or things could be completely out of order, so you're trying to make sense of what they're sharing, but because it doesn't really make sense because things are all out of order. Or there could be some word retrieval problems, so trying to find the right words, And so what can sometimes look a little bit like an expressive language problem is actually this difficulty, this foundational auditory processing difficulty, which leads to this frustration. But then what I see, and this is the sad part, is that as kids get older, they realize how hard it is for them to share that information. And so now it becomes, oh, fun. Oh, yeah, it was nice. Yeah, we went to Hawaii. Anything else? And so they just start to shut down. They just start to realize that either people are not patient enough to listen to their long story, or they just have found it's just too frustrating for them. And so then they just shut it down. Yeah, I know.
Which is so tough because it's one of the ways, and I know I'm biased because I'm a psychologist, but language and expression are the ways in which you connect with others in many ways, right? How do you express your thoughts and ideas and emotions? How do you help people? How do you be understood, feel understood by others? Which is I think, such a critical human desire, right? To be understood by others,
Right.
uh, which leads to belonging. And I mean, there's just so many things that, and I see this with my clients a lot of times where when the work is so hard and the payoff is so little, we just stop.
Right. Right. Yeah,
Yeah.
you do.
Yeah. And that leads to, other things. And I think that's why you're like, this is so sad. Like, that's
Yeah.
like a
And
really
then
sad part.
and then
Yeah.
you start to put labels on yourself,
Yeah.
you
And, or
know?
other people put labels on you.
Exactly. Yeah.
Yeah.
So I always try and empower the student and the adult is, and I really share with the parent, we need to make this child understand they have strengths that other people don't have. So, there's always that artistic side or the creative side or that ability to create a movie or, all of those pieces. And so I always say, we need to start from this is your superpower because it is, and it's a strength. And then as we start to look at, we're getting into high school and we start to think about college, if that's the right route for them, why don't we give them some electives where they can really get into this? Well, let's do some graphic design or some photography or some web design classes where they can really kind of expand their horizons and look at things that they might never looked at. But
Yeah.
instead, what happens is, we put them in a study skills class for their elective and they lose out on that ability to really delve into something they may be amazing at,
Yeah.
or we spend, our summers in tutoring instead of, at an art camp. And so I know it's a delicate balance because we want them to be successful academically, but at the same time, we also have to look at their strengths. And usually individuals with auditory processing have amazing visual strengths. And so that's kind of my go-to because those labels, they can be really powerful, and sometimes when the kids put them on themselves and they'll just say, well, and I hear this all the time. Well, why don't I get it? Why is everybody else moving along and I'm not getting it? Am I stupid? I hear that all the time and it just breaks my heart. So I think and I also try and impart, we all learn differently. And so for some kids to understand, they just learn differently. And so we have to tap into their strengths.
Yeah, absolutely. I think that's great. I feel like when you feel good, you can then take learning risks, right? And learning is risky. It does put us in positions where we're a little uncomfortable. It challenges, it stretches us. And so when we aren't feeling good, we don't have that good base, it's difficult to learn. And that is that's an internal state thing that I think sometimes is hard to see. And I hate those. I call those the moral diagnoses. I'm lazy. I don't care. Unmotivated. Stupid. It's like these types of diagnoses that sometimes are also given, or said to people. So
Yeah.
I love that you're bringing that up. B, what is the treatment? Is there effective treatment? If someone's found, and I'm kind of assuming that treatment does follow specifically whatever type of auditory processing, and I'm sure there's dominant ones and maybe combined types, and I'm sure there's something there. But what does the treatment look like? How effective do you see it? And I know that this is more of a general thing. You'd have to assess someone very specifically in order to give them a specific prognosis. But I wonder if you could generally talk about what treatment is.
Yeah, and I got to share with you. So historically, I started doing this with county schools, and worked there for 19 years, and really had nothing to offer in terms of treatment. And then while I did that, I also started my private practice, and even then, it was really frustrating because there would be these kind of off like wonky, if you will, very systematic approaches that we would try, but really not a lot. And then about 8 or 9 years ago, things started to become commercially available that really were targeting these things. So the big one for me is what we call dichotic listening training, and there's lots of different approaches out there. But you sit down, you do this for the most part, you're doing it at home. Sometimes you do it with a professional. I have all of my clients do their work at home just because I don't have time to do any physical training, but everything is computer based. So they listen to different information in both ears at the same time, repeat back what they hear. Someone's on the computer side, they correct it and say it's a yes or a no if they got it correct or not correct. That being said, it's wonderful. It's amazing. It's so powerful. That's one piece of it, but it's also can be really boring. So that's the trade-off there is that it is boring. There's no question about it. You can't put icing on that. So, but highly effective. And you're typically talking like 3 to 6 months of this kind of intensive, what we call dichotic listening training. And that's typically good for the bridge, and it's good for some pieces of the left side as well. Then there's some really easy apps that you can do that will work on tonal patterning. So labeling tonal patterns, high pitches, low pitches, longs and shorts, which really helps with that prosodic interpretation. Helps with reading, and that, when we read, we pause at commas, we inflect with question marks. So if we can strengthen the prosodic piece, that's really going to help that. And that's easy to do with some simple apps. There's some other programs out there that you can work that specifically target like speech and noise training. There's some simple apps that you could do where you can add background noise in there. So for individuals who have difficulty with speech and noise, that's an easy one. Simple things like if somebody has real difficulty understanding fast speech, then I have them listen to audiobooks at an increased speed. So we go from 1 to 1.25, and just force that brain to kind of retrain itself, if you will. And that's really what it is. I always think of these neural networks or pathways like a freeway. And if you're from Southern California or you're Northern California, the freeways are a nightmare. So what happens is it's just like this neural network of freeways, if you will. So you got a lot of traffic on these lanes. So the goal of the auditory training is really to strengthen those neural connections that are already there, kind of clear the traffic off of the existing lanes. And we're going to build new lanes based on neuroplasticity. This is the exciting part. So not only do we have our freeway now that's open and clear, but we also have new lanes that have been built. So we got this wider freeway and it's open, so that information is now able to get across. But, and here's the important part, we still have to teach that kiddo how to drive on this freeway, right? So even though our 405, if you're from Southern California, is now open, we still have to teach the individual how to drive. So that's where all of the educational interventions come in. So, when you're doing your reading intervention, your speech and language work, your academic interventions, once those pathways are clear, you're going to see so much more effectiveness and efficiency with what is being done. So I get a lot of referrals, from maybe ed therapists who've been working with kids and speech therapists who've been working with kids for a long time, but just they're not progressing the way they should be. It's like at this point we should be where we need to be, but they're not. So then they have to step back and go, why? Where is the problem? So going back to my freeway analogy, if that traffic is on those lanes, you're just not going to get it across. So that's the kind of the foundational piece for it. And the same is true for vision therapy. So the visual tracks also very foundational. So if we can strengthen the auditory pathways and strengthen the visual pathways, now the foundation is laid so that those academic interventions are more effective and efficient.
Yeah, I think that's so great because understanding the complexity of auditory processing and how that's different than hearing, I think helps people understand that it's not literally just about the sound coming into your ear, right? It's about what your brain is doing with that sound, and then how that impacts your output, or understanding and then output, right? And so, that's the commonality, I think, whenever I'm working with someone who says, I just don't get it. Like, I don't know why it's so much harder for me.
Yeah.
It seems like everyone else gets this and I don't. And it's always the tip off for me that there's some sort of something happening that we need to sleuth out. We need to ferret out what really is happening at this level. Because I think the other thing too, if the reading issue is is related to an auditory processing thing, but we hammer it visually, that reinforces, if a student's already thinking that they're stupid, I've seen that do damage, right? Because it's like, oh, this is supposed to work and it's not working, so it is me, right?
100%.
So, anyone out there that's listening to this, and you think, oh my gosh, this makes a lot of sense to me. Like, this resonates with me on some level about my kid, about me, check it out. Like, just check it out. B, if anyone is listening to this and they're like, oh, how would I find, an audiologist that does this specific kind of work?
For
Where
sure.
where would be
So
a good place to go?
I'm going to recommend a great organization. It's called IGAPS. So it's International Guild of Auditory Processing Specialists. I think I got that right. IGAPS. So igaps.org. And you can go right in there. They have a really nice interactive map. So I think you hit find a professional or something like that. And then it'll give you a bunch of different options wherever you are. So I'll say I've often been described as a unicorn because there are not a lot of us who do this. So most audiologists, they just don't delve into this piece. And so there are very few of us who do this. So that being said, you do want to make sure when you find someone that this is what they're doing, because a lot of times I'll get parents who've gone to like 2 or 3 different professionals, and they go in again, they assume they're getting an auditory processing test, and then they just get the hearing test. So you really do need to go to somebody who has had experience in doing the auditory processing testing. So it's a great organization. That's where I would go, because I think you'll get some really nice resources there, and it's international. So if you're in another country, you could find somebody as well.
Awesome. And if you are in Southern California,
Yes,
where,
of course.
what would be the best way for someone to reach out to you, B?
Oh, you just go right to my website. It's auditoryprocessingcenter.com. And just shoot me an email from there. Give me a call.
Awesome. And I will put that in the description in the show notes. So thank you. B, thank you so much for being here and helping us understand what auditory processing is.
You are so welcome, Gwen. And thank you for the amazing work that you do. It's amazing.
Oh, thanks, B.